Distinguished guests, ladies and gentlemen, welcome to the Policy Forum. So our topic is public health and disability amongst the youth or the young people within the context of COVID-19. Individual health and public health is critical to growth and inclusive sustainable development. South Sulawesi is the ninth biggest economy, and its growth is higher than the national average. As with various provinces in Asia, 40% of the population in South Sulawesi are the young people. So there is also a high gap and a relatively high percentage of people with disability, and there is some inequity in development. And the COVID-19 pandemic will worsen this, and this includes mental health issues. So South Sulawesi has been impacted quite badly by COVID-19. I'm Nana Hasnawati Saleh. I have experts who are also members of our research advisory panel. We have Dr. Alan Satriawan. He's part of the National Poverty Alleviation Acceleration Team. Good morning, Bu Nana. We have Dr. Alan Satriawan here. We have Dr. Erna Witular, former special ambassador for MDGs. So actually, she has a lot of titles as long as CV, but I would just mention that she is a former ambassador to the United Nations. And Professor Buddha is part of the governor's team.
Ya, Prof. Terima kasih, Prof. Ada Bapak Ishak Salim.
We have Dr. Ishak Salim. He is a founder for a foundation called Perdik, which is equality for people with disability. So I would like to I have a question for Pa Ellen. The president in his second period has established human development as a priority, and to do so, to develop the nation, we have to have high quality human resources. Can you talk about the issues regarding the development of young people? Bu Nana, ladies and gentlemen, religious greetings, peace be upon us all. If we're talking about the issues in human development, perhaps I would like to quote the release from the World Bank from 2018 regarding our human capital index. And in this release, it stated that our human capital index is about 0.53. And what does this mean? It means that babies born in Indonesia will only achieve about 50% of their entire potential. And this is because of the quality of the health, the quality of the education is not received or is not obtained. And this is supported by and this index consists of four. There's a stunting, a length of education, and test scores and quality of learning. The most concerning is the stunting issue, because in 2018, I should say that we have made progress in the last 3 years quite well, but our final stunting figure was at 27%. For an international standard, especially for Indonesia, which is now a middle income country, that stunting figure is considered to be quite high. And if we talk about stunting, ladies and gentlemen, Ibu Nana, we're not just talking about the posture of our under 5-year-olds who are shorter than their average reference groups, but rather stunting reflects the quality of the individual, and it has a long-term effect into their adolescence and into their adulthood. Study shows that individuals that experience stunting in the first 2 years or the first 5 years of their life usually do not have highest achievement in school, lower quality employment, lower income, and this correlates to non-communicable diseases. So those who experience stunting in their infancy usually are vulnerable to non-communicable diseases such as diabetes, high blood pressure, and others. And these are the factors which impact the quality of the population in Indonesia. Thank you, Dr. Alan. So stunting is not just about posture. So this causes intergenerational poverty because they're not healthy to start with. So they cannot be fully productive. So Pak Elan, we do have face many complex challenges. I would like to hear from you about government policies to handle this issue. So if we talk about specifically about stunting, we have to realize that the stunting issue is a multi-sectoral issue, and we are trying to place emphasis and refocus in the last few years to address the stunting issue in Indonesia. Stunting used to be viewed as a health issue, but it is not merely a health issue. Stunting issue is about other sectors, about awareness, about patterns of nurture. It's about environmental health, such as water, sanitation. It's about access to nutritious food. That means policies on price. It's about food availability. So that's why in the past 3 years, we are engaging all sectors to work together. And this effort to work among stakeholders, both within the government and external parties, needs to be led directly by the highest level of power in the country, the president and the vice president. We have examples with other countries who are successful in overcoming stunting. The commitment comes directly from the president or the vice president. Since 2017, thankfully, we have been able to request the commitment from the president and the vice president, and so the vice president was assigned to handle so the acceleration and overcoming stunting in Asia. Thankfully, ladies and gentlemen, the stunting that used to be stagnant and that's 37%. That means a third of our under fives experience stunting, started dropping to 31% in 2019 to 27.7%. And because it is multi-sectoral, there must be diverse approaches. We need support for the family in the form of social protection, where we have non-cash assistance. We have a healthy or golden family program, and we have to ensure the health of women and adolescents. So I would then talk about the challenges in female adolescents. This is very critical. This will determine. So once this adolescence grows up, marries, will she have healthy children? And we talk about the environment, we're talking about sanitation, we're talking about clean water, which once again is not, this is all handled by different ministries and different sectors. So once again, it is important to handle stunting issue based on a multi-sectoral approach. So you talked about women and gender. Now I would like to go to Ibu Erna. Ibu Erna was the ambassador for the MDGs, which is now the SDGs. So Pa Elan was explaining issues that are implicitly related to MDGs, SDGs, or Sustainable Development Goals. So the overall objective is to leave no one behind. So I have a question for you. How has so during the pandemic, what's your opinion on the implementation of SDGs in Indonesia, and how has it been impacted by the pandemic? Thank you. Good morning, everybody. So if we think about the logic, there are issues that would be vastly impacted by COVID-19, but because I was with Ibu Dian and Bapanas was handling SDGs, and her presentation showed that all the goals of SDGs are being impacted by COVID. So if I may share my screen, I'll share 3 slides that are very easy to understand. May I share my screen?
Nih ya, kelihatan nggak?
Can you see my screen?
Kelihatan ya?
Belum, Bu.
Not yet. We can't see your screen yet, ma'am.
Jadi, oke, di sana ditunjukkan bahwa di.
So it shows that for goal 1, for example.
Saya ngomong aja deh, kalau memang kedengaran, nggak kelihatan, nggak bisa tampil. Nanti saya bisa kirim aja ke.
I'll just send this to pair so that it can be forwarded to those who are interested. So goal 1, so poverty is increased due to COVID, hunger. So COVID threatens food security and increase the risk of bad nutrition or malnutrition. And for health, we know that is the worst or the most badly affected, and this is tangible for all of us, and that is also reducing the socio-economic status, and there's an increase in medical waste, and this is badly polluting the environment, not just due to the medical waste and human consumption causing plastic, and this and there's an impact on education due to the large-scale social movement restriction, and people who are stuck at home are stressed, the parents, the mother, the father, and the children are facing lots of disruption. And so this increases the possibility of domestic violence. And we can look at goal 5.
Dampak kepada gender.
And there's also an impact on gender with regards to energy. And there's an impact on the reduction of the fossil fuel price. And there's a few other more that I don't think I need to discuss here. Increase in unemployment rate, drop in investment, gap due to economic shock and volatility. So essentially that SDGs across the board are at risk, and we need to work harder to achieve the SDG goals. Thank you, Ibu Erna. Now I would like to go to Professor Budu from South Sulawesi. So Dr. Elan and Ibu Erna talked about SDGs in general on the national level. As a member of the team in South Sulawesi, I'd like to speak to you. Can you talk about the development of COVID-19 in South Sulawesi? Bu Nana, to all my fellow speakers, Ibu Erna, Dr. Elan, and Pak Ishak. So I'm with the governor's team for the acceleration of development in South Sulawesi. And for some time, in addition to being focused on guiding the priority programs, the governor's priority programs in health in South Sulawesi, and during COVID-19, we have been assigned a unique and specific task. At the moment, I am a dean at the medical faculty at University of Hasanuddin. I'm also head of the COVID-19 task force, so I'm quite involved, and I understand the details regarding the activities related to the management, the prevention, and interventions for COVID-19. And thankfully, in the beginning, in April, May, COVID-19 in South Sulawesi, the reproduction rate is about four. So each person would infect maybe 4 to 5 people, so that's quite high. But as it developed up to July and August, the reproducing rate from 4 to 3 to 2, and by August to September and going into early October, our rate is at a low rate, so that's 0.7 and even 0.68 at one point. And it appears that in the beginning, by end of November, early December, it were going up to maybe 1, but it's a very plateau sort of wave. And by mid-December, we're hoping for this R rate to drop below 1. So that's the development of South Sulawesi, COVID-19 in South Sulawesi, and this demonstrates a very, this shows very positive results from our endeavors. And the governor and the central government are very appreciative of our innovations, our interventions thus far. So Dr. Nana, distinguished guests, ladies and gentlemen, the reason there's been an improvement, significant improvement, and the government of South Sulawesi was used as a role model for innovations in the management of COVID-19. And the most obvious is the innovation of concentrating. So the people COVID-19s were concentrated and brought together in Makassar, because if we don't control the patients when the R rate was still at 4 and above, we were sure that the transmission would be higher, and the governor's program was quite incredible, and assigned and worked together with the hotel owners in Makassar. So the Makassar hotels were used as a place as a venue for quarantine. So we had 8 hotels. They work with the government of South Sulawesi to quarantine positive patients. So these are people who only had a fever, perhaps a cough. So they were quarantined in a hotel. And while they were at the hotel, they were quite comfortable. They were given vitamins and meals. Thank you, Professor. And we also did contact tracing. I wish to go to Pak Ishak. He's a founder of Perdik, which is fighting for the rights of people with disabilities in Asia. SDGs is very closely related to protection of the vulnerable, leave no one behind. So a vulnerable group which desperately needs attention during the pandemic, especially people with disability. How has COVID-19 impacted and increased vulnerability amongst people with disability? Thank you, Dr. Nana. Good morning to everybody. People with disability have been vulnerable prior to the pandemic. So when the pandemic occurred, that vulnerability became layered, and this is proven by research by the People with Disability Organization survey, and we're talking about the impact about themselves and their social relationships. So the large-scale social limitation measures, working from home, COVID-19 health protocols, and social protection measures, social distancing, has impacted on the ability to work amongst people with disabilities because the majority are working in the informal sector. Their need for therapy has been compromised due to these policies as well. There's no transportation, and it's not easy for them to have the assistance that they normally would. And the process of treatment is also impacted. And those who usually work in associations and children who with autistic children or Down syndrome who would get together, have their therapy and have gatherings. That could not happen during the pandemic, the communication process, and everything that is based online. And so this has been difficult. And people with disability who are pursuing their education more vulnerable when the learning tools or learning aids do not take into consideration their abilities. So the ability to handle children with disabilities, the skills that the teachers usually have to guide the children, this is not something the parents would possess. The school is not very creative in preparing the methods for learning. And how do we reduce this vulnerability? At the moment, both our friends and the government are using a twin track approach through research publication, adjusting the point of view and advocacy for regulation. when people with disabilities are facing problems or facing discrimination. Perhaps this is a blessing in disguise because it is very easy to consolidate between the organizations. So we're developing alliance amongst friends in the movement or in the community. So that might describe the vulnerability. I would like to go to Pak Elan. So you explain all the initiatives to improve many of the issues, but specifically for people with disability, what sort of social protection exists for them? Ibu Nana, ladies and gentlemen, if we are talking about support or policy that provides protection for people with disabilities, we must admit that the existing policy is far from sufficient. I'll give you an example. So within the scope of the social protection program, we have social assistance for people with severe disability. That's a program under the Ministry of Social Affairs. We've had that program for 7 to 8 years or up to 10 years. And this program provides support to those with what would be categorized as severe disabilities. And from year to year, the numbers aren't changing. Up to 2019, there are only 28,000 people in this program. But if we look at all the people in Indonesia with severe disability, we have 10 million. That's for the whole population and for the lowest 40% or only for the poor. So the program needs to be expanded, and this program needs to ensure, so that we're talking about expansion in the sense of increasing the scope of the beneficiaries and also ensuring the support. If we learn from developed countries, providing support to the people with disabilities is given in the form of cash, but it's also possible to provide this in support in other forms, assistance in transportation to basic in order to access basic services. So there's cash support. There's also in-kind support. So for these two aspects, so we're talking about the scope and benefit, I think we still have a lot of work to do. And in the president's team, we are trying to encourage the ministry and the Ministry of Finance to increase their budget, and the Ministry of Social Affairs to improve their program, and Bappenas, or the National Development Planning Agency, to include this program. And I would also like to add, if we talk about program of people with disability, we should not just rely on programs from the central government. The subnational government must have the same concern, and they have the resources through their regional government budget. They should chip in to provide the protection for people with disability, once again, in the form of cash support, especially for those who are poor, as well as in-kind support. That's it, Dr. Nana. Thank you, Pak Elan. If I can go back to Professor Budu. Professor? So we heard the explanation from, so we've heard from Dr. Isaac and Dr. Elan about support for people with disability and other vulnerable groups. Can you talk about South Sulawesi? What is being done by the government to answer this challenge? So for the provincial government, as Pak Elan and Pak Isaac mentioned, so, we talk about the stunting program. Thankfully, in 2015, 2017, the stunting figure in South Sulawesi is relatively high. 34.5 to 35%, but by 2019, that number has dropped to 5.1%, about 5.1%. So we went from ranked 4th to 11th in the national ranking. So the governor's team prioritized stunting. The first 1,000 days of life is our focus. So we focus on newborns and also expecting mothers were given special attention with regards to improving their nutrition. So there's been a lot done for stunting, both working with the health office and also with the Department for Empowerment of Women with regards to maternal and child health. So we have a movement for a public movement for eradicating stunting. So perhaps I don't need to talk about the budget allocated by the governor for this program, but all regencies, we have 6 regencies that were the main target in handling stunting, and by 2021, there will be 6 more regencies included. So the management and overcoming the stunting numbers and malnutrition is a key program for the governor, in addition to other programs in health, such as development of regional hospitals in several regencies and areas. And finally, because maternal and child health, according to data, a lot of these issues are happening on the islands. So we have the sea ambulance and floating hospital to provide connection between the islands. So this is for handling women in labor and also managing their health. So that's it from me, Bu Nana. Thank you, Professor Budu. Before I ask everybody, I would like to remind the participant, please post your questions in the Q&A. We still have 8 minutes. So the last question, this is for all panelists, I would like to ask. So if we reflect on the complex issues, issues that require coordination, I'm sure there are programs that are actually important but may not be running well. I would like insight from our panelists regarding what should we be driving and what are the key issues and how should we be better managing them. Thank you, Nana. We're talking about effective programs, be that for developing or increasing the quality of human capital, handling stunting, handling COVID. We need to talk about the key aspects on this. So the budget is clear. So we have sufficient budget. So I need to talk about non-budgetary aspects. So our lesson learned in assisting the government, the ministry, agencies, and the vice president this issue. Design is key. Program design is key. We're not just talking about good intentions, but we need to look at the design of the programs and the data to be able to achieve, and data regarding the beneficiaries of the program. We do need to identify the beneficiaries, and we need to ensure that the benefits of the program reaches the appropriate beneficiaries and the quality of implementation. These are the 3 important aspects. I do have an example. We've done monitoring and evaluation, which shows there are programs that are successful, even though there are some additional notes, such as the non-cash food allowance. So we do have direct cash transfers, and we have evaluated that the impact has been quite good on alleviating poverty. And the Family of Hope program, PKH, is also doing well. Every year, the government budgets for a program to reduce anemia. Anemia is very urgent and correlates directly with the stunting issue. This is a national program, but the last health survey showed that anemia has increased amongst expectant mothers and female adolescents, so we need to know where the problem lies. So the government needs to work with other stakeholders, including academia and NGOs, to look at the three aspects: design, data, and the beneficiary, and the quality of the implementation, so that we make sure that it's all being handled optimally in order to ensure an effective program. Before I go to Ibu Erna, we did have a comment that unfortunately we don't have sign language here. So we are providing language interpretation, but we do not have sign interpretation, but this is very good input. So we have 4 minutes. What are the urgent issues right now? You're still muted, ma'am. So I do want to underline the gender issue. So in all aspects, women are the most vulnerable during COVID, whether we're talking about domestic violence and women in MSMEs who are directly impacted, women who are working, facing terminations, they're suffering very much. However, I'm very happy that there are many programs which are able to support women to rise again. So from the Ministry for Women Empowerment and Protection of Children, and also with UN Women, have programs to support women in MSMEs to recover. And I've seen that there is a need for support regarding mental health, that the Ministry of Health or whoever is here can pay attention to, because mental health issues is not just for women, but also for children and for the husband or for the family. And they are very vulnerable during COVID. The cases on mental health cases have increased, so the support for the impact of COVID within the household, and also support for on enterprises during COVID also is important. Professor Budo, your closing statement. What needs to be improved at the moment that is urgent in your opinion? So if we're looking at stunting, for example, it cannot be resolved just by focusing on the infant and the mother. This is a multi-sectoral approach. Improvement in infrastructure through to the villages is a program that is excellent for unraveling the stunting problem, because economic status would be better, and with good economic status, health will be improved as well. So with the disease such as tuberculosis and other diseases causing anemia needs to be focused on. And also we need to We also need to focus on resolving the issues of stunting. Dr. Isak, your closing statement. For me, I think there are opportunities that we can utilize from a policy standpoint, especially for disability. I think in Indonesia, I think this is different from what Bailan was saying. We have ratified the convention. We have the laws on disability, and the organizations are encouraging the operationalization of the law and the implementation laws. There's proper accommodation in education, access to accessibility and disaster services, and also access to justice. And there are 20 provinces who have regional regulation on disabilities. There are regencies and municipalities also with regulation. And in the villages, there are opportunities that are quite critical because the inclusive village program or initiative is improving. When the government provided a social security network, many villages conducted data collection for people with disability because the government is supporting to prioritize the village development fund. As an inclusive village, there are definitely challenges. We call it idealism. So it's a view that considers people with disability as second-class citizens. So this impacts on many issues, stigmatizing behavior and stigma in literature, stigma in many facets. But we have good opportunities with the regulation. The problem is that we still have a lot of work to do with the process variable, the bureaucratic level. Bureaucratic level is an issue. The collaborative work with people with disability organization needs to continue. Distinguished guests, ladies and gentlemen, we have come to the end of our time. I would like to thank all my speakers. They are members of the Research Advisory Panel for PAIR. So I don't need to draw any conclusions. I think we have a lot of work to do.